Healthcare professionals, including physicians, nurses, anesthesiologists, nurse anesthetists, pharmacists, medical students and residents, and pharmacists, are at increased risk for substance abuse. Approximately 10 to 15% of all healthcare professionals will misuse drugs at some time during their career. Approximately 6 to 8% of physicians abuse substances, and up to 14% abuse alcohol. Approximately 20% of nurses abuse substances. Higher rates of substance abuse are reported in emergency department personnel due to high-stress work environment and increased access. Redlands Community Hospital has established a policy to detect users and remove abusers of drugs and alcohol, and to prevent the use and/or presence of these substances in the workplace. Any violation of the policy by any employee or job applicant, including a positive confirmed drug or alcohol test result, will subject the employee to counseling for disciplinary action up to and including termination of employment or rescission of the job offer. The hospital may suspend employees without pay under this policy, pending the results of a drug test or investigation. However, research has suggested a more successful approach with handling cases of substance abuse. Alternative diversion program. Some behavioral signs to watch for in the employee are emotional liability, mood swings, irritability, depression, suicide threats, euphoria, inappropriate verbal or emotional responses, diminished alertness, confusion or memory lapses, noticeable deterioration in or exaggerated attention to hygiene, strong breath fresheners or perfumes as a cover-up, wearing long sleeves at all times, and an increased isolation from colleagues, friends, and family. Some job performance signs may include gradual change in job performance, moves to positions perceived to have less pressure, responsibility, visibility, or supervision, requests for change in work schedule or assignment that may increase access to drugs, poor or illogical charting, such as lack of documentation or inadequate content, errors in judgment, particularly with medications, excessive use of sick time, particularly after days off, unexplained absences from work, long breaks, frequent or unexplained disappearances from the unit, and an odor of alcohol on breath and/or frequent use of breath mints or gum. The major addition to the substance abuse policy at Redlands Community Hospital was the addition of an alternative diversion program. Upon suspicion of substance abuse, the department supervisor will meet with the employee and discuss the event and have the employee give a sample for a urine drug screen. The employee will then be sent home on a suspension while further investigation of the event takes place and the test results are completed. After the investigation has ended, the department supervisor, along with human resources, will determine if the offense qualifies for the alternative diversion program. A first-degree offense qualifies the employee for the diversion program. Therefore, the employee will be allowed to return to the facility to discuss terms of agreement for contract. The second-degree offense. This offense does not qualify for the diversion program. Therefore, the employee will be terminated and reported to the licensing agency. After the employee has been qualified for the program, they will sit with the department manager and draw up a contract of terms and conditions. Upon agreement of contract terms and conditions, the employee will be allowed to return to work under modified duty, wherein the employee will have limited access to medications and no access of narcotics of any kind. The employee is subject to on-the-spot drug testing at any time during the contract period by the supervisor's discretion. If the employee refuses to cooperate with the above alternative disciplinary actions, it will result in automatic termination of employment. Upon successful completion of the recovery program, 12-step and/or peer counseling, the employee will retain his or her position and efforts will be reported to the licensing agency. Continuing education on recovery and substance abuse will be provided every month. There will be a probation period of 2 to 5 years with limited access to narcotics and randomized drug screens at any time during the probation period. Photo story created by yours truly. Images by Sylvia J. Special thanks Kay Stoker RN and Josie Bray. County Nurses Class 2010. Dr. Stoner, this one for you.